Hi, I'm Dr. Sarah, owner of Antigo Veterinary Clinic. We wanted to talk to you today a little bit about dental care for your pet. Dental disease is one of the most common problems that we see when we're doing physical exams. In fact, by age 2 or 3, most cats and dogs have some degree of periodontal disease. Left untreated, that leads to chronic inflammation in the gum line, chronic infection, pain, and eventually loss of teeth. We want to help prevent that. The most important things that you can do are start doing some dental care at home and have regular dental cleanings done for your pet. We wanted to make a short video for you to show you the process of a dental cleaning here at Antigo Veterinary Clinic. The first part of a dental procedure is a thorough physical exam, and we're going to do a head-to-tail physical just like we would normally do for an appointment. And the reason why that's so important is that if there's anything that we find during the exam that might affect the anesthesia, we want to know that ahead of time. We also can reassess the stage of dental disease that we're looking at. Since it might have been a while since we last saw your pet, things can change fairly quickly in some animals, even over a period of 6 months. We listen to the heart and lungs and make sure that we don't hear any heart murmurs or issues with the lungs, since those are vital for handling anesthesia properly. We're also going to get the patient's vital signs during this process so we know what the baseline of normal is, and that way while we're monitoring the anesthesia we can compare to what's normal for that pet. The next part of getting the animal ready for the procedure is giving an injection of Xrenia, which is a drug that helps with nausea. A lot of the anesthetic agents that we use can cause tummy upset or vomiting, so we want to minimize that as much as possible. And the second thing we're going to give in most pets is something for sedation and pain relief, so that we make them less likely to experience pain during the procedure and afterwards. So when we sedate the patient, we are going to use a cocktail of drugs that are designed to reduce the amount of anesthesia that the pet requires. So the next part of getting the pet ready for the dental procedure involves shaving the leg to put an IV catheter in. Next step in the dental process is administering an IV anesthetic agent, and that allows the insertion of an endotracheal tube. The endotracheal tube is important because it helps deliver oxygen and gas into the airway and also prevent fluids from going down into the lungs during the teeth cleaning. The patient is then connected to the anesthesia machine and ventilator. All of our anesthesia procedures involve important anesthetic monitoring. We use a SurgiVet anesthesia monitor. The SurgiVet anesthesia monitor helps us to observe the electrocardiogram, blood pressure, end-tidal CO2, and pulse oximetry so that we can monitor all the important vital signs during the anesthesia procedure. The next step in the process of the dentistry is to perform full oral dental X-rays. It's very important to allow us to assess the structures underneath the gum line, the periodontal ligament, the teeth root, and the underlying bone. After the dental X-rays are completed, the veterinary technician then performs dental scaling and polishing, and this allows removal of the plaque and tartar both above the gum line and below the gum line. After completing dental scaling, charting is done, during which each tooth is checked for periodontal pockets, gum recession, fractures, mobility, resorptive lesions, or dental caries. The teeth are then polished. After completion of procedures, the pet is moved to a kennel for recovery from anesthesia. A veterinary technician attends to each patient during the recovery process. Depending upon the degree of your pet's dental disease, they may or may not need extractions. There's a few different kinds of procedures that can be involved in extractions. Sometimes if it's just a simple extraction where it's got one root, we can just simply loosen the tooth with dental elevators and then use a dental plier to remove the tooth. Other times when it's a multiple rooted tooth, we need to create a flap of gum where we remove that off the bone and then actually remove bone from around the roots and section the tooth into components and then remove each part of the tooth. We then would close the socket with that flap of gum tissue using suture. Whenever we do extractions, another important part of the way we do things here at Antigo Veterinary Clinic is to do nerve blocks at strategic points to help improve comfort of your pet after the extraction procedures. Lastly, we include a 2-week follow-up to recheck your pet's mouth after the dental to make sure everything is healing properly. We feel that dental care for your pet is an important part of their overall health and hope this video has helped you learn more about dental care for your pet. Please don't hesitate to ask us any questions should you have them, either our veterinary staff or doctors. Thank you.